All right, I'm going to get us started. Welcome to the first climate change and health seminar for this semester. If we haven't met, I'm Daniel Carrion or Carrion, and I'm faculty here at HSPH in environmental health sciences. I am very excited for the first seminar to have Dr. Gary Adamkiewicz join us today. I'm not going to read his full bio. You should have access to it. But briefly, Dr. Adamkiewicz is an associate professor of environmental health and exposure disparities at the Harvard T.H. Chan School of Public Health, where he leads the Healthy Cities Lab. Dr. Adamkiewicz's work focuses on the connections between housing and health and understanding disparities on environmental exposures, largely focused on the indoor environment. He's done work at the local, national, state, and international level, and I'm sure you're going to hear lots about it and be able to ask lots of questions. I've been lucky to know Dr. Adamkiewicz since early on in my Ph.D. days and have very much appreciated his work and over the years. So join me in welcoming him.
Thanks, Daniel. I really appreciate that. This is my first time at not HSPH, YSPH. Slip of the tongue. Really happy to be here. As Daniel said, my work mainly focuses on the connection between housing and health. I do a lot of work that you might call indoor air quality, housing and health. I have a strong interest in work that touches on questions around environmental health disparities and environmental justice. And hopefully you'll see that during the talk. I know this is a climate change and health seminar series. I'm going to mainly talk about my work that unpacks indoor air pollution within housing and low-income housing settings. But there are many threads to the climate question, and I have some studies which are directly related to climate, which I'll talk about at the end. And I've tried to pack in, because I know people have different interests, I've tried to pack in a lot of material. So excuse me if I rush through things, but happy to answer any questions. My goal is to go for about 40 minutes, and then we'll have plenty of time for questions. Before I start, it's really important, I really want to thank the amazing team of students, research assistants, project managers, colleagues who have helped me these last few years. There's no time to go over every individual person and how much they brought to the equation. These last two columns are the 8 doctoral students I've had in my time at HSPH. I call them the Great 8. I'm really happy to have worked with them and continue to work with them. I like to focus folks on the indoor environment, usually by asking everyone to take a deep breath and exhale. And I want everyone to recognize the fact that that breath took place indoors. And in many places around the world, especially the US, it's really common for us to spend more than 90% of our time indoors. So that means 9 out of 10 breaths you take in your life happen indoors. And this is part of the reason why I study these microenvironments. We are spending so much time in these spaces, and especially home environments, residential environments, are largely hidden from a lot of the tools we use to understand environmental conditions. We have air pollution networks that exist throughout many cities in the world, but we don't necessarily know what's happening in each individual home. If we think about ambient air pollution, we can think about wildfires, industrial pollution, traffic. There's no doubt that even if everything is perfect within your home in terms of minimizing environmental exposures, if your neighborhood is heavily burdened with these pollutants, your indoor environment is going to be heavily burdened with those pollutants. But there are lots of examples where there are unique exposures indoors that we need to understand. In the framing of climate, the same story really holds, that The home is where many people are experiencing the effects of climate change. So whether it's flooding in Vietnam, a hot day in Ahmedabad, India. This is an image of a homeless encampment in Phoenix. This is flooding in Boston. I don't know if people have seen some of these statistics, but about half of the heat-related deaths in Phoenix are actually among the homeless. So there are so many of these really strong connections between environmental conditions and our health risks that I think are underappreciated, and not enough effort has been put into policies at the ground level to address them. And home to home, things are very different. So, like I said, we don't have air pollution networks that allow us to understand everything that's happening within a neighborhood. If you think about building design, building operation, furnishings, personal care products, cleaning products, whether people use pesticides or not, if people have mold problems or not. I'll address some of these issues as we talk about them today. But before I do that, I want to sort of walk you through some of my thinking as it's evolved over the past 10 years or so. About 10 years ago, I published this paper with some colleagues called Moving Environmental Justice Indoors. And this was really meant to sort of put out a framework for thinking about understanding disparities in indoor exposures, that they aren't just random, that they are really the net result of a lot of structural, behavioral factors that we can actually understand. If we understand the root causes of many of these exposures, you can actually deconstruct the problem to try to solve it. So having that deeper understanding can help you address the problem. We were happy that this paper was actually named a paper of the year by the American Journal of Public Health. And it represents the start of my thinking about how to address environmental issues indoors. And in my group, we sort of work in these 5 different buckets, trying to understand environmental health disparities, using better exposure science techniques, which I'll talk about, using intervention and implementation science, a strong emphasis on community partnerships, and then a transition to policy. In the world of public health, I really do believe that if your work can't be translated into action, then we should question why the work is being done in the first place. And it doesn't need to be translated into action tomorrow, but there needs to be a thread between understanding the problem, identifying solutions, and figuring out how that gets to the task of mitigating those. Another framing which I've embraced is the fact that making housing healthier is not just about building healthier buildings. It's really about these 3 Ps, people, places, and policies. And so for places, in the year 2025, we actually do know a lot about how to build a better building or how to renovate to a healthier standard. But just as important are the people and the policies. And for policies, I'm not talking about necessarily national policy on what chemicals are in products, but policies with a lowercase p, the policies that are in place, whether there's a smoke-free policy or what the policy is in a multifamily building related to addressing pest problems without dosing or exposing families to high levels of synthetic pesticides. And then the people aspect is really important, both in terms of education, as well as really drawing from the lived experience of people who are experiencing these exposures to understand how to best intervene. So I'll touch on some of this as we go through today. And then the other sort of critical moment for myself and my thinking happened about 10 years ago when we were studying secondhand smoke exposure in public housing in Boston. for folks who don't know or aren't familiar, federal public housing is normally divided between what people call family housing or what people call elder/disabled housing for those two different populations. This happened to be a site that was elder housing, and we saw some of the highest levels of indoor PM, fine particles that I had ever seen in my studies. And it really got me thinking about, I was just talking with Michelle about indoor neighborhoods. You know, when you do so much work in multifamily housing, you start to realize there is such a thing as an indoor neighborhood. How many people in this room have lived in an apartment where they could smell their neighbors cooking, smoking, or other things, right? So you're obviously sharing air, and a lot of those pollutants move from space to space. So it's not just about what's happening outdoors, it's what's happening indoors. But when you think about all the epidemiology that's out there that shows that when air pollution rises and falls in New York or Boston or New Haven, there's a relationship with health outcomes or hospital admissions. It's not shocking to think that, you know, in a multifamily building, you could have those same fluctuations, which are much, much higher than what's happening outdoors, which could trigger an event. So there's this whole world that's sort of unseen and hidden from all the air pollution modeling we do. And this really has driven me to really try to understand what's happening in real time in apartments, in units. So indoor neighborhood exposures, there are temporal triggers which require temporal exposure assessment. And there could be this exposure happening where vulnerable populations, and once again, this was an elder site, so there was a higher prevalence of smoking in the building and a higher prevalence of folks who spent a lot of their time indoors. So all of the ingredients were there to have someone exposed to a particle level which could be dangerous for their health. I show this slide normally not to scare people, but to really emphasize the fact that indoor environments are complicated. But the good news is that over the last 40 years or so, we've actually learned a lot about individual exposures in homes, combustion byproducts, lead, volatile organic compounds, semi-volatile organic compounds. We've learned a lot about thermal conditions indoors. So it's very complicated, but we actually can understand a lot of these things. And some of these exposures have been addressed by things like green building standards and other approaches to reduce chemical exposures. And having proper ventilation in the kitchen takes care of some things, having smoke-free policies. So there's a lot going on, but we've actually learned a lot. And then the question is, so for about 10 years, my group and others worked on trying to understand exposures within public housing, mainly in Boston. And we found a lot of problems you might imagine, like pest problems, exposure to combustion byproducts from stoves that weren't properly ventilated, mold problems, chemical exposures, a lot of different issues. And the question is, how do you intervene? So over the course of the last 20 years, there have been interventions that the Boston Housing Authority has undertaken, largely informed by the academic community in Boston, related to ways of moving the needle on reducing exposure and improving health. So for secondhand smoke, the Boston Housing Authority was the largest housing authority, was the first large housing authority in the country to go smoke-free back in 2012. Over the years, they've changed their pest control practices. So it used to be really common in public housing where every 6 months, 6 to 12 months, a contractor would just come into your unit and just spray synthetic pesticides all over the place, basically. And not only are those approaches not effective in many cases, but they leave residues that last for years and years. And we've actually seen that. We've done studies where you can take an alcohol-soaked piece of gauze, wipe the kitchen floor, send it to a lab, and you'll see detectable levels of pesticides that were banned 15 years or 20 years before the sampling event. These residues do not just naturally degrade and don't just naturally evaporate. There are also significant capital needs. Most public housing authorities around the country have been grossly underfunded over the years. And these capital needs and these energy efficiencies inspired some green transitions where sites were redeveloped to be green buildings. And I'm going to talk about that as one of our key studies. So this transition to green, this is motivated by the need for capital improvements and the need to be more energy efficient. But more and more green has green, in quotes, has incorporated healthy housing attributes. So even where you might be at odds, so for example, having proper ventilation in the kitchen and bathroom comes at some energy cost, but having that ventilation is good for reducing exposures and improving occupant health. So those elements have been slowly incorporated into green interventions. The main site that we studied is in an area of Boston called South Boston. And this is a site called Old Colony, which was originally built in the 1940s. This is really common of Boston public housing. They were built between the 30s and the 60s. And they're typically like 3-story brick buildings that are in desperate need of renovation. What we were studying is really the combined effect of approaches across the 3 fronts that I mentioned. So the goal was to build green and healthy buildings that had all the attributes that could reduce exposures. Policies were in place such as smoke-free housing and better pest control that didn't expose families to unnecessary exposures to synthetic pesticides. And we also had an educational component to make sure that the families who were moving into these units had everything they needed to know to when they moved into the healthy unit, they had the tools that could keep that unit healthy. So what we did is a series of studies looking at various environmental exposures and health effects. One of the first studies, and so this is comparing year 1 to year 2. The green lines are families who were in an old unit in year 1 and a green unit in year 2. The black lines are folks who were in old units in both years. We saw a statistically significant drop in fine particle levels. This is a function of a few things. This is a function of having a smoke-free policy. This is a function of finally having real ventilation in the kitchen and bathroom that vents to the outside. The other thing we found in data I won't show today is that these buildings also acted as a filter for outdoor air. So you can look at sulfur content in particles as a marker of particles of outdoor origin. And we saw that the green buildings had lower concentrations of particles with sulfur content, showing that a good tight building with proper ventilation is a good formula for reducing exposures both from indoors and outdoors. The other thing we looked at was nitrogen dioxide. We saw a 66% drop here. I don't know if in the past few years you've seen any of the press around gas stoves. I know folks in this department are doing work around gas stoves. So gas stoves are like the single biggest source of NO2 in most apartments, most homes. And just moving from a gas stove to an electric stove allows you to get a pretty significant drop. The only reason you don't go to zero is that NO2 is coming from all sorts of other places. Any form of combustion, so tailpipes, fuel oil burning, all of those sources emit NO2 into an urban environment. So this is an aerial view of one of these sites of Old Colony. This was originally an 800-unit development. and the redevelopment happened in stages. So the area to your left, families were moved off-site, those buildings were demolished, rebuilt, and then those families moved back about a year later. And then eventually, like right now, this has all been redeveloped in phases 2 and 3. So basically what this sets up is kind of a natural experiment to really look at the effect of these housing improvements. In many cases, a lot of housing studies are confounded by neighborhood and SES, these other factors. Here you have a similar population living on both sides, living in the same neighborhood, and the major change was really the fact that people were able to move into these buildings that were green and healthy. Oh, shoot. Oh, here we go. Sorry, I missed this. So aside from the pollutant levels going down, we saw that adult symptoms like general respiratory symptoms were reduced. We saw asthma symptoms for adults with asthma were reduced, but not statistically significant. The biggest improvements were really for children diagnosed with asthma, and pretty stark differences between the two sides of this picture. So asthma symptoms and hospital visits were between 3 and 4 times higher on this side compared to that side. So this does align with everything we've learned over the years about all the different asthma triggers that exist in the indoor environment. But going into this, you're never sure if when you put all these things together in a bundled intervention, whether it's actually going to produce results. So that's one aspect of our results from this study. The other thing is, aside from these buildings being unhealthy, these buildings were also terribly inefficient and had old systems. And so just for the first 120 homes or so, we published a paper that showed that with the new buildings, just on operating costs for electricity, gas, and water, they were saving around $600,000 a year. If you were to monetize the health improvements added to the energy savings, this starts to be a number people should really pay attention to. It doesn't necessarily offset the significant cost of new construction. I'm not saying new construction is the answer to all of our health and housing problems, but this is the natural experiment we had available to study. So basically, we're trying to put together this balance sheet through these papers to show that these green improvements have benefits in terms of indoor air quality improvements, health improvements, and utility savings. And so depending on who you are, you may gravitate to one or more of these things. Sometimes people who manage the portfolio might care most about this last row in terms of what the operating costs are of a development or a building. So the other thing we were doing at this time is really trying to provide evidence so even though Boston Housing Authority had gone smoke-free in 2012, nationwide public housing did not have any smoking restrictions. And so our study received an award from the HUD secretary at the time. Around the same time, HUD released its national public housing smoke-free policy, and we were really happy that one of our studies was incorporated and cited into that proposal. And I cite that for one specific reason. Sometimes I've been involved in studies where I really feel like, why don't people know this already? Why am I proving the obvious? But research really can provide value in policy making. So HUD at the time didn't just want a study that showed that smoke moves from one unit to another. They wanted us to show it in public housing. So it was the only study of its kind that showed in public housing, the setting where they were going to propose this policy, that we were able to show that smoke moves from one unit to another. We had separate studies that showed that in non-smoking units in some of the apartments, it was the equivalent to someone sitting in the apartment smoking a cigarette per day. And a cigarette per day doesn't sound like a lot, but if you look at the epidemiology of smoking a cigarette per day, 1 to 4 cigarettes per day is where the risk curve starts to take off. So then the question is, so that was a bundled intervention. You might ask the question, are structural improvements sufficient? Can you sort of design your way to healthy housing without focusing on those other things? And I really do believe you can't. And so the other element of our work is really trying to develop better tools, better evidence, and really providing evidence around implementation. So it's one thing to say something's bad, but as a research community, we really need to provide the evidence around the solutions that can be implemented by city leaders, by state authorities, or by the federal government. So I'm gonna just sort of quick through that. And part of that's the situation that I cited around the smoking in senior housing really inspired me to take advantage of this other trend that was happening about 10 years or so ago around the increased availability of low-cost sensors that were of decent quality. Now, 10 years ago, I would say half the sensors on the market were really not very good. That percentage is lower now. So there are more high-quality, low-cost sensors on the market, but there are a lot of devils in the details, and we could have a whole discussion about that. But we created these sensor platforms that we could put into people's homes to really take the pulse, so to speak, of what's happening indoors, see what people are actually experiencing, which is frequently very different from what's happening outdoors. So I'm not going to go through all this, but this is the use of these sensor platforms. We're applying in a lot of different ways in community-based studies. We're trying to incorporate them into new epidemiology. So this practice, methods, and evidence fronts are where we're trying to use these sensor platforms to improve the field. So for example, these are 3 studies that we've incorporated sensor platforms in that cover 3 different areas of epidemiology and 3 different health outcomes. I'm partnering with colleagues on a study of sleep disordered breathing, where we're trying to understand whether indoor environments contribute to that problem. We're doing a national study on male reproductive outcomes, where we're putting sensors in people's homes, in young male homes for 90 days, which is the window, appropriate window for spermatogenesis, where air pollution exposure might affect those outcomes. We're also doing a study of a condition called bronchopulmonary dysplasia, which I had never heard of before I was approached by John Gaffin. But it's a condition that results from being typically born premature and being on a ventilator in those early days of life. Being on a ventilator is obviously beneficial, but being on a ventilator that early in life has alters your lung in some ways that have long-lasting implications. And people haven't really done a lot of studies on what exacerbates respiratory problems for these individuals. So we're trying to move the needle on this front. And just to get, of those studies, the one that's done effectively with data collection, we have published a paper which showed that children exposed to high indoor PM 2.5 had approximately 3 times the increased odds for sleep disordered breathing compared to those with lower indoor exposure. And this is in a case where the indoor levels were not highly correlated with outdoors. And if you control for outdoors, you don't see a big difference in the odds ratio. So I'm not saying every health outcome we study in the indoor environment is going to reveal an association like this, but it does inspire me to sort of dig deeper into seeing where there are these hidden triggers for outcomes that people are experiencing behind closed doors in their homes where they're spending a lot of time every day. The other side of the image, we're testing a lot of different interventions. A lot of these are community-based studies, and I'll touch on a couple of them right now. The one study, like the redevelopment at the Boston housing sites that I mentioned, Boston is about to renovate the oldest housing development in the city of Boston. It was built in the late 30s. It's also one of the largest. It's a $2 billion redevelopment. It covers 26 acres. And this is one of those developments where they're transitioning from public housing to mixed income. So they're maintaining 1,000 units of public housing in the new development, but they're adding 2,000 market rate units. I wish they had changed that ratio so that it was increased it from 1,000 to 2,000 and 1,000 market rate, but those are the decisions that are made in the world we live in now. So this is what the old housing looked like, these brick buildings that are decades old. This is what the new development is going to look like, and it has many of the attributes that we studied in the example that I cited. So we're collaborating with folks at Boston College on this study, and we're really trying to understand all the different implications of this kind of transition, what it means for physical, emotional, behavioral health, and we're doing that alongside trying to track the environmental conditions. As a baseline, we measured indoor fine particle levels in a sample of more than 100 units on the old side, where we saw that in most cases, most people are actually above the ambient air quality level for PM 2.5. It turns out, even though there has been a smoke-free policy for a long time, smoking is still pretty prevalent. And part of the motivation here, and I'll go to the next slide. So we know that smoking of any kind, candle use, incense use, air fresheners, marijuana use, all contribute to fine particles in the air. We actually created an index showing that the more of these sources you add, the more you get above and outside the range of the ambient air quality standards. So our mission here is to have a thorough environmental assessment of what's happening that is behavioral on the pre-side. Many of the structural and operational elements are part of the new construction. And so we want to know where we need to intervene to make those two things dovetail together so that residents are engaged in activities that don't expose their family and their neighbors to high levels of PM, as well as the building helping in that equation by having proper ventilation and all these other aspects. So where can you put the people, places, and policies all together? It's not just, like I said, about building a better building. And they just broke ground on this redevelopment, so stay tuned for our study of that. Now, the other question is, how can we move the needle on behavioral interventions? And we just finished a 3-year study funded by the Department of Housing and Urban Development to see whether having a tool in your home that gives you information about air quality in your home could help you control what's happening in your own apartment. So there are two things we're basically testing: an educational model, which is the difference between giving people a list of things they can do in their home to reduce PM, like avoid smoking, don't light candle, or not necessarily eliminate, but reduce these things, versus an active education. So we created like a 15-minute walkthrough where we walk with the resident around their own apartment and actually stop at every place that's relevant to talk about how to use the ventilation system, what things are good or bad that we see around the apartment. So it's just that extra little nudge toward giving people the information they can use. And then in terms of monitoring, we were testing the difference between having a monitor in the home that just gave us data about the levels in the home versus having an air pollution monitor with feedback. And in the year 2025, I think most of us are, people have sleep apps on their phone. People are used to taking data, using it, adjusting, seeing how outputs respond. And I really do feel like even without detailed discussions of air pollution sources and chemistry or any of that, if you gave people an air pollution monitor and they could sort of watch it change throughout the days and weeks, that gives people a tool to use to sort of control their air pollution. So we basically had three groups. A group that had the monitor without feedback and passive education, a group that had the real-time monitor with passive education, and a group that had both the monitor and active education. These are very freshly prepared graphs. So we haven't published this. So this is just for the presentation today. This is the scatter plot that shows the difference between post and pre for the three different groups. And you can sort of see that the distribution, so anything down here would mean they reduced their levels. Anything above 0 would be an increase. You can see as you go from A to B to C, this tail starts to grow. And also the increase tail starts to shrink. So there's sort of a shifting of the distribution. So what happened just over a period of a few weeks is the first group actually increased in concentration a small amount. The second group decreased 2.1 micrograms per cubic meter, and the third group decreased by a bigger amount. And the difference that was statistically significant was between this last group and the first group. So I sort of throw this out there as another thing to think about in terms of how do you work with individuals, work with communities in ways that give them tools that allow them to have agency and take control while we're trying to solve things for which individuals sometimes don't have control. If you look at I was a little curious to see whether this was about people reducing the peaks, like the events in their home. And these are the changes in the 95th percentile. And you sort of see, it's sort of a similar pattern where you see this biggest change in group C. And 3 micrograms per cubic meter doesn't seem like a lot, but when you look at how air quality standards have changed over the years, the most recent change went from a standard of 12 to 9 for fine particles. That was a delta of 3. So given the intensity of this study, which was not very intense, I do think there's a lot of hope here for giving people tools that they can use rather than just saying buy an air cleaner. I really don't think that's the first approach to dealing with indoor air quality issues. The other thing we did is sort of look at if there are any demographic differences between the folks who had increases versus decreases. The folks who were successful at decreasing trended, once these are all trends, tended to be older, tended to be female participants, tended to be those with working kitchen fans, and tended to be those who had some use of kitchen fans at the beginning. Another thing we're working on, so a lot of this work has been conducted in public housing and in low-income communities. The other thing we're trying to do is work with privately managed low-income housing. So and it's actually hard to work with the private market in housing studies frequently, because no one wants you to publish a study on how bad their development was or how bad their building was. And so you really need people who are forward-thinking and visionaries to partner with you. So we're partnering with one such developer right now, and they have sites around the country. And we're trying to provide a formula for them to identify, assess, and fix housing problems. So, and it turns out that to the folks who are managing this portfolio, this is just a snapshot of feedback we gave them. I'm anonymizing the site name. It turns out that even though these data kind of exist in work orders and in other data sets, this was surprising to the folks who are managing the entire portfolio. There's no substitute for getting data directly from your residents about what conditions are they happy or unhappy about the heating situation, the cooling situation? And this is the only way to really get to really identify housing problems and fix them and mitigate them. So this is another site which just seems to have problems across the board. Everything colored in red is sort of worse than the median. And so here you have folks who have a problem with mice, they have problems with cockroaches, they have improper ventilation in the kitchen, they have problems with heating and cooling. So it's not surprising to see a lot of problems in low-income housing. This is also a developer that has taken on properties from other developers. So, you sort of assume the problems of the portfolio, but the only way, you can't fix it until you measure it. So the last, how far am I? The last couple of things I want to talk about are related to very recent studies. We have a P20 study grant from NIH, which is focused on climate change and health. We have a really great team up in Boston working on this study. And we're working in 3 different areas of the world. We're working on a study to look at providing cooling resources to high-risk seniors in Boston who are low income. A study looking at refrigeration of fish in villages in Madagascar, because fish spoilage is a big issue as the climate warms, and a cool roof intervention in Burkina Faso and South Africa. I'm in charge of the Boston study, which we call Beat the Heat, which we're focused in 2 environmental justice communities within Boston. Unfortunately, this is one of the grants that was pulled by the federal government. So we were scrambling this summer to really sort of keep it alive. We were able to recruit about 40% of our original target. And this was the basic study design that we were recruiting individuals who didn't have air conditioning, age 55 to 95 in environmental justice neighborhoods, and those who had one of these health conditions. And then we did a step-wedge design where folks were randomized to either receive an air conditioner now or next summer. And so this is a project which has been halted, but I wanted to present it just to show you that even in the interactions with participants and recruiting them or going through the process of talking with them about the study, you start to learn the things you didn't know you needed to learn. And so I think people understand that individuals might not be able to afford air conditioning, or if you have air conditioning, you might be able to afford to use it as much as possible. But there's all of these devils in the details. We came across a lot of families whose apartments were under-conditioned. So folks had really small air conditioners, which were maybe the only ones they could afford, which were in one room. And definitely didn't do a job of cooling the apartment and barely did a job of cooling that room. There are folks who have made decisions on which room or which bedroom gets an air conditioner. So there are parents who might have an asthmatic child and choose to put the air conditioner in the room for that child, which all makes sense. There are folks who are renting rooms. We saw a lot of problems with people not understanding the implications of heat for their health. And these are folks who do have underlying health conditions that make them vulnerable to heat problems. And, most people who have diabetes don't think of themselves as being especially vulnerable to air pollution or heat, but they are based on the epidemiology. So I was telling Michelle and Daniel that the more I do quantitative research, the more I see value in doing focus groups, really talking with affected communities about their lived experience. I mean, we've been doing elements of this for 20 years, but there isn't a study where it doesn't have value. Like, if your research team does not have the lived experience related to the thing you're studying, you need to talk to people where you can learn from that lived experience. And the last bit I'll just talk about are some of our community-based studies, which have also taught me a lot in the last few years. I was part of an international study called Pathways to Healthy, Equitable Cities, and we were working in various cities around the world that were rapidly urbanizing, trying to understand how cities could evolve to be both healthy and equitable. One of those cities was Dhaka in Bangladesh. And when we had workshops and community meetings with stakeholders in Dhaka, we came to them with problems we thought we could address, like transportation and air quality and housing. But it was interesting. The one question that kept bubbling up had to do with how densely developed so many of the low-income neighborhoods. I don't like the word slums, but what folks would call slums in Dhaka, that you don't have natural light hitting the ground in some of these neighborhoods. This is not the kind of problem you can solve tomorrow, but in a city that is continuing to grow and where the growth of the city is happening in informal settlements and some of these neighborhoods, they wanted us to tell us what we know about this problem. And we had never done anything like that, but we took on the challenge and we created a three-dimensional model of every building in the city of Dhaka, created a ray tracing algorithm that traces the sun's rays into all of these neighborhoods, and created a hotspot map of where these were the biggest issues. Now, this is not that different from what people might have told us, but we're just submitting this paper now, and several journalists in Dhaka are anxious to see this published because they want to open up a public dialogue about this. So this is the other way that, so the lesson for me is no matter what you go in with, be prepared for a community to identify the issue that is most important to them, and also recognize what they see as the value of research in a dialogue. And so they see the value of our work in this dialogue. We're not necessarily going to solve the problem, but we're going to raise the issue and start a dialogue. The other way I've seen to sort of contribute research back to the larger problems in the state of Massachusetts has to do with mold in Massachusetts. So the state of Massachusetts changed its sanitary code to include a provision that apartments can't have any sign of water damage or mold in them. I got a call from the Attorney General's office saying that this rule was going into effect, but the Attorney General didn't understand enough about the connection between mold and health. What's a big problem, a little problem? How do you fix it? How do you advise? What's a significant violation? And so what I did is convene a group of experts that I happen to know who have been working on these issues for 20 years, and did a briefing just for the Attorney General's office. And that's another lesson I've learned in recent years, is that there are lots of ways for you to contribute to the dialogue, which don't revolve around publishing a paper or writing a grant or giving press. So that turned out to be very helpful. It allowed the Attorney General staff to ask all the questions that were on their mind, but in a private forum where they could ask questions that they might have been embarrassed or they felt funny asking in a public setting. So that's another. So I'll just wrap up by another project where a local housing development approached us because residents were really struggling with a lot of the housing issues that I've talked about already. And this, in a way, I think, what we're doing now is we're engaged in a 12-month process that I've called a co-production framework for healthy public housing at Archdale, this single site. And actually, strangely enough, I don't think I would have proposed this if the world wasn't upside down this year. Like the fact that funding was being pulled and, it just left the world in such chaos that I thought, okay, I'm just going to propose something that I think we can do with almost no money, but I think is the right strategy to solving a problem at this individual site that maybe could turn into a model for how we solve problems more broadly. And so this is basically about getting all the stakeholders at a single table for a period of 12 months, including residents, management, maintenance, the housing authority, and our team, to basically talk through facts that we collect through focus groups and surveys and create a line item for every problem we identify. And as long as everyone understands at the outset that we may identify problems that need significant capital investment, where we can't really solve it right away, but at least we've put it on the docket, so to speak. So we're about halfway through, we're not halfway through, we're 2 steps in, and we've already learned a lot about some of the operational failures within the system that can be solved. You'll find that you could go in with a framework of science, but the management, communication, stakeholder dynamics can be the thing that's getting in the way of progress. So we're hopeful about that. We're also involved in a study of looking at climate change in the city of Accra in Ghana. I do think when you look at housing and health issues globally, the global south, cities in Africa, there are certain places in the world where we really haven't done a lot of the research necessary to address housing issues outside of a longstanding history of doing studies around like cook stoves and like burning of solid fuels. So we're doing work in Accra. This work is about to be published. I'll finally end on some images related to cities and climate. The other thing which we're engaged in now is really connecting city leaders with the best advice and evidence possible. More than half the planet lives in cities now. It's going to be 68% in a couple of decades. And cities aren't just on the front lines of these environmental issues, the public health issues, and climate change issues. They are also probably the places where you can most successfully implement action and respond to these things. So mayors are really on the front line. And so we're partnering with the Bloomberg Center for Cities at Harvard, which every year trains mayors on how to, on better governance, on how to use data, how to manage teams. We're going to be working on all these fronts through a Harvard Urban Health Initiative. Sorry for going long. Happy to answer any questions you have. Just wanted to sort of, I know there's urban health work happening here at Yale, and so would love to know about any of that. But happy to answer any questions you have. Yeah, go ahead, Dave.
I have 2 completely separate questions, but if other people have questions, I'll ask one. My first one was, what are your thoughts on grandfathering policies with regards to housing.
Yeah,
Parameters, because I also know pragmatically, you can't just say, demolish, you rebuild it, but.
yeah, this has been a problem. I mean, the first housing laws in the United States happened in New York City in like the 1860s. And everyone thought this was going to change the world, and it only applied to new housing, like it applied to new tenements. Well, who's building new, like, so this has always been a problem. There are no easy fixes to that. That's why I think, we still have a responsibility to think about other points of entry. So it's not, so the same way, like Massachusetts, like most states, has a sanitary code, right? So that's not an element of the building design necessarily. It's about the function of a building and what it's providing. Like you have to provide a home and a unit that is free from pests and is free from mold and is properly heated during the winter. So I think, we have to be looking at other ways in like that to think about whether we should have proactive housing inspections that have standards. There are some cities, so Boston now has a proactive housing inspection system. It used to be housing inspections were just in response to problems, which unfortunately doesn't allow you to get ahead of anything. And so I think things like that, and also other points of entry about like what is safe, what is healthy, how are you achieving the rights that a tenant would have are the ways to do it. It's hard to say everybody needs to change existing housing. I mean, people are trying to decarbonize and sort of change heating systems and do that. So I might be more cynical than the average person about how politically that could happen. Sorry if that's an unsatisfying answer.
For the sake of time, maybe one more quick question.
Yes.
To this great presentation. My question is a bit philosophical, so I really appreciate your comments when you yesterday in the presentation about working with communities and the value of that.
Yeah.
So my question is about the fact that there can be research fatigue in communities.
Yeah.
Especially, I mean, you're doing a lot, and all your party work is in Boston, which is one of the best studied cities in the world.
Yeah.
Really. So how do you deal with that in your working with communities when we're wanting information from them, no research, they're wanting resources? They may feel they've been studied many, many times.
Yeah, no, we definitely know that, hear that, experience that. I don't need to tell you that, there are more researchers per capita in Boston than most cities. And we sort of bump into each other. So the ways we've sort of gone, sort of approach that is, really looking at it from the citizen, the resident's point of view, like what activities are we involved in that have value for an individual, or even if you can't imagine that it's going to help you, how would it help your neighbor? And sometimes that working with community leaders, like we work at some developments where there are really strong, heavily networked community leaders who basically are the gatekeepers to say, you guys can come in here and do this because you've explained to me how this turns into value for the folks living here. And like I said, it doesn't have to be everybody. It could be, you show me how it has value for seniors. You show me how it has value for children with asthma. So that's one way. We also always reevaluate, how we compensate people for their time or respect their time or respect their input. With this 12-month process that we just started engaging in, we made sure that resident leaders were involved in focus groups and were properly compensated. And we had more time to explain what we're trying to do. And I also think it's good for all of us to be put to task about, is this research that's just sort of floating in space? Or where can you show value to the people you're studying? So I know that's not a super detailed answer, but we've experienced that and we're asking ourselves those questions all the time.
So if you are a student or trainee, there is lunch with Dr. Adamkiewicz in 6:10. So feel free to continue the conversation in 6:10 right after this. Otherwise, let's thank him again for joining us.